Family Hospice and Palliative Care is one of the oldest not-for-profit hospices in Western Pennsylvania. In fact, they began as a volunteer-supported hospice before there was even reimbursement for hospice care. So it began as a social movement assembled by local healthcare providers and volunteers in the community, and then of course has grown over time with the introduction of the hospice Medicare benefit and the aging population here in Western Pennsylvania. The biggest strength of Family Hospice as an organization is our staff. The people at the bedside and people like myself and like you that are behind the scenes are doing this because it's a calling, and are doing this because they know that every day we all walk on sacred ground. And that level of commitment to our mission isn't something that can be duplicated by just hiring anybody. So we listen carefully for the clinical skill, but we also listen carefully for the hospice heart when we interview people to come on board. So our biggest strength is the staff, because they are Family Hospice.
End-of-life care is the ultimate in patient-centered care. It ties exactly with safety and quality. You are trying to do the most good for your patients, and you are trying to focus your care on their needs. And the question we most often ask in hospice when we have discussions about what we're going to do is, what's most important to you, the patient? Because that's really what this is all about. Our goal is your goal. If your goal is you want to make sure your wife gets taken care of after you're gone, that's our goal. If you want to have your grandchildren taken care of, or have something special, have a ceremony, a birthday, whatever it is, that's our goal. Coinciding with that is in order to make that stuff happen, we have to make sure you're comfortable. So oftentimes what we do in hospice is we very aggressively manage symptoms. We very aggressively manage pain and shortness of breath and nausea, because those are the things that keep you from your goals. We call it the hospice bounce, and what we sometimes find is we have patients who are extremely sick come on hospice, and we focus not on their illness, but on making them feel better. And once we start making them feel better, they suddenly have a little bit more energy to devote to that activity, whatever it is that they want to do. So, our goal is not to give patients medications to put them to sleep or do anything untoward. Our goal is to make you feel better so that you can do the things you want to do. And that is the ultimate in patient-centered care, and that's what we try to deliver.
My role with Family Hospice and Palliative Care is an RN admissions nurse, which gives me the opportunity to be the first face that my patients and their families get to meet. Some of the first questions that my families ask are, how does the program work? Are there any charges? How often are you going to be here for us? Who is involved in my significant other or parent's care? And what's the plan of action going to be? The types of patients that I admit into our hospice program are those that have a life-limiting diagnosis that no longer want to seek treatment. There's a variety of different types of diagnoses which involve cardiac, respiratory, neurological, and cancer patients. We see patients wherever they call home. It can be, at that time, a hospital, a nursing facility, independent living, or their family or their home.
The volunteers here with Family Hospice are an integral part of the organization, whether it's behind the scenes or enhancing the lives of our patients and our families. With the behind the scenes, I like to think about volunteers that are touching the patient right from the beginning to the very end. So we have volunteers that do the admission packets that go out with the patient, and we have volunteers that do bereavement calls to the families and write notes to them too as well. The patient volunteers help in a number of different ways in terms of maybe going out to the house, sitting with the patient, So the caregiver can go to have lunch with a friend, go to the grocery store, whatnot. Or they're just going there to visit, be that friendly visitor with the patient and spend time with them. Or they're going to a nursing home or a hospital to visit. Just all kinds of different ways that they help our patients and their families. The volunteer pool has really kind of grown and is diverse. We have volunteers of all ages. We have retired folks, and then we have high schoolers. Just recently we had a wonderful high school student come to the center after school and play her violin for a patient. And I know how much that meant to that patient as well as all the patients on the inpatient unit. And then we have college students that volunteer, and just people from all different walks of life that maybe have been touched by hospice and want to give back in some way. And whatever their talents are, we try to find a fit for them to be able to use those talents, whether it's playing a violin, whether it's taking your therapy dog to visit patients, or whether it's walking dogs for our patients that can't get out to take their dog out or care for their pet. My volunteers really say they get so much more than what they give in their interactions with the patients. And they learn life lessons that sometimes they can't get in other settings because this is just a critical, very important time for patients.
We offer a lot of community support. I think that's important for the public to know. And our bereavement support, whether it's support groups or children or teen camps, is free to the community. You do not have to use family hospice, and palliative care services in order to utilize the camps or the groups. Our 6-week bereavement support, that is a specific educational program, and we have an actual educational packet that we provide to all of the participants in the group. The people who facilitate the groups are trained volunteers. Typically, they're retired professionals from the field. So we're very blessed, very lucky to have people who are able to provide such a great deal of care. Our children's camp, that is a very great outreach program, and it's a one-day camp, which is very interesting, so that there's not a huge commitment to it, because a lot of times parents or guardians are hesitant if there's a huge commitment to something, but they're able to come with their child. Ages 6 through 12 we offer for the children, and we are able to do different sorts of things at the camp, such as art therapy, music therapy, pet therapy, and the kids really get a lot out of it. And we have professional, maybe retired volunteers, as well as our professional bereavement staff and family hospice and palliative care clinical staff as well at those camps. Our teen camp is relatively new, and we hold it at a place called Auberly in McKeesport. And Auberly has a type of a challenge course, which is a little bit like an obstacle course, because what teen wants to sit around and talk about grief? That's pretty intimidating to them. So it's being able to utilize a teen's greatest instinct, which is typically movement, getting up, getting around. And they tackle these challenge courses with their parent, guardian, whomever the family member is, as well as our family hospice staff and the Auberly trained staff as well, in order to overcome these obstacles.
So hospice and palliative medicine are a medical specialty unto themselves. We have an affiliation with many educational institutions in the area, and we educate many resident physicians, medical students, nursing students, social workers, and so on. We bring them into our centers here in Lawrenceville and in Mount Lebanon. We take them out into the field with us. We have learners of various kinds who go make home visits with our staff. We have learners who come into the inpatient unit and experience that. We have a very highly regarded training program, especially for hospice and palliative medicine physicians, and they spend quite a lot of time with us here because it's such a great learning experience for them. Nowhere else do you get such a concentrated view of all the varieties of patients that come through hospice, and you learn so much, and the learners who've gone through and evaluated us tell us that, how much they've learned through this experience, so we're very proud of that.
All of us meets the end of life eventually. And for many of us, that's a process that takes weeks or months rather than a sudden event like a car accident. And I would love to see end of life for everybody be something that's comfortable, be something that isn't frightening, be something that doesn't have a sense of mystery and powerlessness to it, something that's informed, supportive, and entirely comfortable. And for me, that's what hospice and palliative care does. And I wish everybody knew that this was a choice that they had.